You are listening to the Horse Radio Network, part of the Equine Network family.
Greetings, everyone. Coach Jen here, and thanks for tuning in to Horse Tip Daily, episode 1482, brought to you today by Equiotic, live probiotic supplement for your horse. Today, we learn all about tendons and ligaments with Dr. Lacher, what they are, how they function, and why it's so darn difficult to get them to heal once injured. And speaking of darn difficult, it can be pretty daunting to choose a probiotic supplement for your horse. So let's talk probiotics for just a moment. Bluegrass Animal Products Equiotic Supplement is a live daily probiotic supplement for your horse. Equiotic is the only probiotic sourced from horses' good gut bacteria. This allows the good bacteria to survive in the GI tract. Clever, eh? Veterinarian developed and recommended, Equiotic is trusted by horse professionals to keep their horses feeling their best. From the top competition horses to backyard companions, Equiotic can help to keep your horse's sensitive GI tract feeling good. To learn more or to order, you can go to bluegrassanimalproducts.com. You can use the coupon code HRN for 15% off Equiotic packets and paste. That's 15% off by using the coupon code HRN at bluegrassanimalproducts.com. And by the way, more cleverness, Equiotic is also available at many retailers, including SmartPak and Chewy. But the coupon code HRN for 15% off is only available at bluegrassanimalproducts.com. I'm so happy to welcome to the show Dr. Lacher from Spring Hill Equine in Newberry, Florida. Where's Newberry, Florida? It's just above Ocala, people, so it's right next to the horse capital of the world. Thanks for joining me today, Dr. Lacher.
Thank you for having me. It's always great to be here.
It's always fun to have you on. You are a podcaster of some experience because you have your own podcast called Straight from the Horse Doctor's Mouth. Go to any search engine and put that in. There's lots of episodes, so you'll find it easily. So we're going to talk today a little bit about tendons and ligaments because tendon and ligament injuries are oh so common in sport horses, and you even see them in pleasure horses nowadays. So we're going to start out with what's the difference between a tendon and a ligament, because they're not quite the same.
They're close. They're adjacent, basically. So a ligament attaches bone to bone, and a tendon attaches muscle to bone. So, for example, a common one that we think of is the suspensory ligament, and it attaches the sesamoids that are down at the bottom of the fetlock to, at the top, it attaches to the very back of the knee or the hock. So it's attaching to those bones. So that's a ligament, right? It's attaching the bone at the top to the bones at the bottom. Versus, let's take the deep digital flexor tendon. It comes off the deep digital flexor muscle and then comes down through the back of the leg and eventually attaches to the bottom of the coffin bone.
So they serve two different functions. Now I have a question. A muscle has two ends. A muscle attaches two structures together. Is there a tendon at each end of a muscle?
Yes, there's usually, so the way that we do muscles is you have the origin and the insertion. So the origin is sort of where a muscle starts and the insertion is where it ends. Typically at the origin, it's less tendony, but it's still tendony. Like it's kind of concentrated muscle tendon fibers at the top. And then at the bottom is where they usually have their long tendon that attaches down, especially in horses, because they have that stupid walking on their middle finger plan.
Yeah, who thought of that? My gosh. So with tendons, is the top of a muscle always up and the bottom of a muscle always down? Or can you have the top of a muscle lower to the ground than the top of a muscle? Is it always oriented that way?
It's always sort of oriented anti-gravity. So the top is above and the origin is above and the insertion is below. Except when you get into things like neck and back muscles where you're talking about them running horizontally. So it gets a little complicated. But
that'll be a different conversation. We'll do muscles next time.
Exactly.
So they have different functions. Are tendons and ligaments actually made up of different tissue, or is it the same tissue slightly differently organized?
It's basically the same tissue. They're all varying levels of collagen, and they have a similar function. They just go about it in a little bit of a different way. They're both designed to keep things from flying apart, right? So like that suspensory ligament, you want to keep those sesamoids from flying off the bottom of the fetlock. And so you're using an elastic tissue to hold it. And deep digital flexor tendon, same thing. You need to connect the top of that muscle to the bottom of the structure that it's trying to act on. So the way that you flex your fingers, or your horse flexes their foot, is that they tighten that deep digital flexor muscle, but it needs a way to send that signal. And so the tendon is basically how that force gets transferred to the bottom of the foot. If you want to get really deep into the weeds and geeky, it's also in horses a way that they store the energy of footfall. So one of the big things horses are designed to do is trot across the savannah all day long. Not that any of ours do that. Mine would probably curl up in a ball and die if I asked for that. But, they're designed to do that. And so tendons and muscles also store the energy that comes back up from the ground.
A little bit like that stretchy rubber band concept?
Yep, exactly like that stretchy rubber band concept.
Okay, so that's what they do, and that's how they're made. So the next question is, of course, horses are all the time injuring tendons and ligaments because horses live to try to kill themselves. We all know that. Why is it that the horse doesn't just go, excuse me, this little tendon or ligament over here, it's kind of sore, so I'm going to limp a little bit? It seems like they're either fine or really not fine. Why does that happen?
Some of that happens because horses are what we call a prey species. So other things eat them. And in the wild, that's what they're designed for. So if that's what you're designed for, you don't want to show weakness because the predators are going to head for you. So unfortunately, their job in the evolutionary world works against us a bit, where they hide some of these things until they can't do it anymore. The other problem that we have with tendons and ligaments, and both of them will do this, is that they get achy before they blow apart. So it's you or I, like I have tennis elbow, not because of all the tennis I play, but actually because of all the teeth that I float. So that tennis elbow for me, like, it's not crippling. I know it's there, but it's like a low level ache. And so often that in particular, horses will push through. The problem is that while they're doing that, you have, if you think of the way on a microscopic level that these structures hook together, it's almost Velcro. And so you have the Velcro tearing little bits at a time. And at some point, the Velcro can't hold what it's being asked to hold. And that's when we get the blow apart injury that we see. So there's almost always some level of low level injury before we have the blow apart.
And they just don't tell us.
A combination of they don't tell us, and in some ways, the body doesn't always do a great job telling its human or its horse that there is a problem, because there aren't the same level of innervations into tendons and ligaments. They're sort of a wasteland of blood and nerves and some of those sorts of things. So they get some feedback, but not always the same level that we get from other structures.
So there we go. So the next question is, in layman's terms, you hear about a bowed tendon or a torn ligament. Can tendons and ligaments each be torn or bowed? Is there a difference, or is that just layman's term of a generic phrase for a injury? What is physically going on in there?
Yeah, those are both basically the same thing. Essentially, we have tears happening, and we either have them at the micro level, which is where we have a horse that is sore. Like you'll come to your vet and you'll say, like when I turn to the left, it doesn't feel great. The horse isn't overtly lame, but I can't get them to turn left as well. And let's say we look in the foot and we find that there is some change in the fiber pattern, and that's what we're looking at. These are big, think of like telephone cables running down. So we should see like these nice straight lines coming down the leg. And instead, what we'll see is that it looks like we've got some fluid between that. We'll see most of this we do with an ultrasound. So gray is good, dark gray is not great. So we'll see a lot of dark gray in with all that light gray. And that's telling us that there's fluid in there. And that is swelling, edema, the same thing we'll see elsewhere in the body, but it's in the tendon or ligament. And those are sort of micro tears when we can see them on ultrasound, but we can't palpate them on the horse. Like if we run our hand down, things feel good. And those are typically the horses that are giving us subtle signs like, oh, I don't want to turn, or I don't want to stop, or, like all of a sudden there's some change in their behavior that they're doing, versus the horse who comes up, in the morning you go out to bring them in for breakfast and they're holding a leg up and there's obvious swelling and heat in a leg. When we put an ultrasound on those, you can see like massive holes in the tendon or ligament, basically. So it's just a level of how they've pulled it apart, and they can do the same thing to any of the tendons or ligaments.
So that begs the next question. A bone can heal in 8 to 12 weeks. Why is it that tendon and ligament injuries take 12 months or more to heal? Why does it take so long?
Well, there's a couple of reasons. One of them is that we go back to that really stupid walking on the middle finger design. I question the thought process behind it. It's not great. So we have a lot of forces coming down on these tendons and ligaments. The other problem that we run into is what we talked about before, where there's not great vasculature, nerve supply, all of the things we need to bring in supplies for repair. We don't have large volumes of those running through tendons and ligaments. There's a great video on YouTube of where they show kind of cutting through a tendon, a deep digital flexor tendon on a horse. And one of the things that always strikes me on that is like there's nothing. You're just looking at white tissue. There's no blood vessels in there. And so we need that supply chain. We got to supply the Amazon of the tendons and ligaments, right? And so we don't have deliveries coming in, so it takes longer to get repairs done.
Now, it used to be you turned the horse out, you blistered the horse, you bandaged the horse a lot, you stall rested the horse a lot. Are there newer treatments that are shortening that length of time, or is it still a case of rest and wait?
There's a lot of research out there on, especially coming from the human side, on the best way to heal these. None of what we do in terms of healing really shortens time frame. So we have a saying that however many letters there are is how many months it's going to take. So like tendon has 6 letters, so that's 6 months. So obviously ligament has more letters, so that's more months. What we're trying to do with the healing process on these guys is not necessarily shorten it, because there is no miracle cure for that. But we're trying to get the healing process to happen better so that we get a better quality at the end. This is where some of the newer biologic products like PRP or stem cells are super useful, because what those two products do is go in and we are kind of jumping ahead on the supply chain. We're saying, here you go. Here's the things you need to repair this tendon, and we're putting them there for you. You don't have to recruit them from the body. Boom, there they are. We're putting them there.
You're getting overnight delivery instead of 6 weeks of delivery. Yes.
Yeah. You get PRP Prime. So we put them there and we say, okay, here you go. Here's the things you need to repair it. So have at it. The other thing that is really, really, really important with tendons and ligaments, and I literally cannot overemphasize this enough, is controlled exercise. Tendons and ligaments do not heal in a vacuum. If we put these horses up in space, they would never heal, because tendons and ligaments require feedback from the system to heal correctly. So turnout, yes, I know that some of these horses healed, and it's because they're horses and sometimes they do what they want to do, and they would heal in the face of less than ideal circumstances. But if you're going for, I want this horse back and I want this tendon or ligament as strong as it can be, then it is controlled exercise. And so that does involve stall keeping, but I don't like to use the word stall rest, because we're going to have to work on this horse needs to walk This horse needs to move. We need to make sure that things are moving in the correct plane. That means not a lot of circles, lots of straight lines, and gradually increasing the load on that tendon or ligament as it's healing.
And that is so hard to do.
Yeah, I always tell my owners this is going to be a long slog, and I can provide pharmaceutical intervention for your horse to try to make it easier. You may want to seek out pharmaceutical intervention for yourself to make it easier.
There we go. Because it's a long, slow slog. Even if you've paid for some expedited delivery of healing products, PRP or IRAP or something like that, it is still long, and horses don't always love that. But there you go. That's the basics of tendons and ligaments. So if people need a little bit of extra help, they're curious, they need to find out more, where can they find Spring Hill Equine on the web?
So we have the website springhillequine.com, which will point you to all sorts of different things. It can point you towards our podcast, as you mentioned earlier, Straight from the Horse Doctor's Mouth. The other thing that we have on there is our clinic cat is quite verbose, and he does a blog every week on all of the things that he has learned from being a clinic cat for the last 12 years. So we have Tuesdays with Tony on there, which is our blog about all kinds of stuff. And then there's access to our YouTube channel on there as well, where we have videos talking about lots of horse things.
Perfect. Thanks again, Dr. Lacher.
Thank you.
And a big thank you to Bluegrass Animal Products, the makers of Equiotic, for sponsoring today's show. Don't forget, you can go to bluegrassanimalproducts.com, use the coupon code HRN, and get 15% your purchase of Equiotic packets and paste. Equiotic is also available at major retailers, but the coupon code is only good at bluegrassanimalproducts.com. Well, there you have it. Horse Radio Network has thousands of engaging podcasts for horse people, and you can have them sent right to your phone. Just subscribe via your favorite podcast player. This is Coach Jen, and I will be back again soon with another tip. Until then, go ride your horse. The Horse Radio Network and the Horse Radio Network hosts are not responsible for statements made by guests on the Horse Tip Daily. Please use your own judgment when listening to the tips on this show.